So welcome back to Voices in Health and Wellness, where we explore how practitioners, clinic leaders and healthcare entrepreneurs are navigating the ever-evolving world of care delivery and what it really takes to both thrive clinically and operationally. Today's guest is someone who brings a uniquely integrated perspective to that conversation, Nathan Bratko. Nathan is a certified nutrition specialist and licensed dietitian nutritionist with a master's in clinical nutrition. He plays a key role at both Chesapeake Health and Nutrition and the Bay Pediatric Center in Eastern Maryland, blending advanced nutritional care with hands-on experience in pediatric health settings. Nathan, thank you very much for your time this afternoon and welcome to the show.
Oh, you're welcome. Thank you for having me.
You're very welcome. So maybe we can start at the top. Could you maybe tell us a little bit about the different roles that you have in the two places that you work and how those worlds kind of intersect?
Right. Yeah. We often wear many hats in our field. So I think in one area, yes, it is very clinical, individual one-on-one practice where I partner with a local doctor's office, pediatrician's office, and I am referred clients, usually the clients that are, or the patients that are at like the highest risk of like either needing to gain weight or lose weight, obesity or, starvation. But then I'm also seeing a lot of like food allergies or digestive issues, even like type 1 and type 2 diabetes patients. And then on the other side of my role is in public health nutrition education. So I am funded through a grant with the University of Maryland to work closely with schools, elementary schools in a school-based setting to educate children on nutrition and teach nutrition education classes in an elementary school setting. And then there's the advocacy too. So I sit on a number of health councils and hunger coalitions. Went to a meeting this morning to listen to hear what the most pressing issues are in food access and sustainability throughout my area. So it's quite interesting. I guess no 2 days are ever alike, that's for sure. And it definitely evolves over time as well.
I'm sure. And I was going to ask you as the next thing, what does your typical day or typical week look like in practice, accepting the fact that no 2 days and no 2 weeks are the same, but in terms of how you kind of integrate all of those things into your week, how does it kind of pan out?
Yeah, I would say my schedule is very concrete, and I think it's an important piece of any clinician practitioner is to have like days where you're in an office and days that maybe you're in the field, days and hours that you're seeing patients, and then days and hours dedicated to like notes and administrative tasks as well too. So I do set up my week as like maybe Monday, Tuesday, or Wednesday. I'm working in a school teaching, nutrition classes and meeting with children. And then maybe towards the end of the week, I'll be in practice, at the office, doctor's office, seeing patients. So, and I usually have that booked out several months in advance. That way it's, it's there and I can count on having that organized.
Got it. So. What major shifts are you seeing in pediatric or functional nutrition at the moment, and particularly, giving us your US perspective?
I would say a lot of we're seeing a lot of I would say mental health, at least in this area, and this is a lot of coming from that post-COVID. We're still seeing a little bit of the remnants of that. At an early age, we often see picky eating. Children that have aversions to sensory aversions to certain foods. That's usually around 4 or 5, maybe 6, stemming all the way up to age 9. As soon as I get into more of the teenagers, I do see a lot of more of that desire to more of the desire to focus on their body image. So I may see children or adolescents wanting to exercise more or wanting to look and feel a certain way. So you may see some body image issues in that field.
That's really interesting. And I mean, obviously, with a functional perspective, do you have any sort of sense of what the kind of the key root causes of some of these things are in your experience?
Yeah, so we look at gut health, a lot of gut health, and I really think that's going to be an emerge. That's going to be consistent all around too, is because how we're the digestion issues and their gut health play a role in all functions throughout the body, especially in like mental health. So so I think just getting the vitamins, and if we look at like the standard, like in America, like what the standard diet for children is highly processed foods. So they're getting, they're not really getting the nutrients they need in order to thrive and in order to function at like at a high level. And it all starts with like how they're absorbing those foods too. And so I really think gut health is important, an important topic.
Amazing. What about how receptive are, I mean, you mentioned you do some outreach work, you're working in schools, you're educating. How is this sort of nutrition side of things received by children, particularly the ones where you obviously see them not having a great diet? How do they receive the kind of education that they get in this area?
Oh, they love it. Yeah. So we make it fun and exciting. And I can't probably emphasize that enough as like a nutritionist, is to, make it fun and exciting for our audience. And so to paint a picture of what it looks like is, if we go into a classroom full of like kindergartners around 5-6 years old, and we bring either, fresh fruits and vegetables, and we talk a little bit about shapes, colors, sizes, smells, really expose them to that sensory, getting them to identify certain fruits or vegetables through their senses. We make certain connections on, how it's grown, where it comes from. And then we have a taste test, so kids get to taste and try these foods. And then they get to vote on, if they enjoy it or if they dislike it. And then there's like a little reflection so that they can use certain use adjectives and learn, connections to literacy. So they can go ahead and identify and articulate like what they tasted and tried. In a controlled setting like that, in a classroom, our outcomes are very favorable. Kids really enjoy the tasting and trying new foods with their peers. They're more likely to try something that may have scared them prior. There's certain aspects of that are hard to duplicate at home. So if they go home, with the hope of it, oh, hey, mom and dad, I tasted melon today at school. Can we purchase melon, and have it at the dinner table? Well, their grocery store, their local market may not have some of those items. So we make a point to work throughout the community to select local produce items that they can readily find at the market. So,
I mean, you're hoping the kids will be sort of a secret agents of change in trying to improve the family's diet by sort of taking your learnings out of the classroom at home and trying to influence what happens? Or do you think there's a block there? And despite all this wonderful education, it's at the end of the day what the parents put on the table, which is what the kids are going to be eating.
Yeah, it's a little bit of both. So yeah, it is for the connections to home and having children feeling empowered to ask their parents, who I like, tasting salad, I like having salads, or I like having, fresh zucchini or something. And can we get that? Parents may be like, well, I don't know how to cook it. So there's a little bit of the, how do I prepare it? That kind of like disconnect, or there's the fear that when parents may not purchase a certain item because they feel like they're going to wait, like if the whole family doesn't like it, or if they don't like it, they feel like they wasted their money on something that's just going to be, thrown away. So there's still a lot more work to do, working with parents and showing that parental connection and having that parental connection, to empower and not only children to ask for healthier foods, but then work with parents as well too, to teach them and build their confidence or their self-efficacy to prepare it for the family and for themselves.
I understand. And are you noticing more families, parents looking for sort of more integrative or nutrition first approaches? Are you getting that sort of a sense that the stuff is what the public are looking for, or are you constantly having to kind of educate people from the ground up?
It's different on different levels. I will say we find, depending on our audience, going from, working with low literacy, low income individuals to say middle and upper class, you do see that change in our audience, with one area, you get a lot of, families that are just happy, when you're promoting, healthier foods and physical activity. And, I do have many families that I also still work with that may look towards, like vegetarian diets or meat alternatives and looking more for like natural and holistic methods to treatment of like diseases like such as like food allergies or so I do see a wide range, and I see it more. It's more it's different between audiences and socioeconomic classes. So,
got it. The places you work at, are these state clinics that you're working in? I'm trying to understand the setting, because obviously everything's a bit different in the UK. I'm just trying to understand what kind of model you're in.
Yeah, so the Bay Pediatrics is a private healthcare center. Okay. I do accept all health insurance, and I also accept federal subsidized health insurance, which would be our Medicaid. And I work in a public school setting, which is state run. So, it's a little bit of private, and then, then obviously I would say a majority of the work I do is like public.
Got it.
So
I was going to ask you about insurance, because I've spoken to a number of sort of clinics and health businesses in the US, and the insurance reimbursement thing is one of the major bugbears. I just wonder whether that impacts on your work. Whether it's one of your bugbears or it's something you've managed to navigate with ease.
Yeah, so I have a team of people that really help and provide me with wonderful support to navigate the insurance world.
Okay.
Because there is a lot of challenges from, getting credentialed with insurance companies, the contracts, and then the billing and payment. So it's no small feat, and it really does take like a team of individuals to try and help navigate that in the States. And there are care models and a lot of note taking and phone calls. So we have what we call a prior authorization. So for nutrition counseling, you have to show call up the insurance company to get prior authorization for you to treat a patient. And once that gets approved, well, then you can treat the patient for a certain amount of visits based on a certain rate. So, no, it's quite the process to do it. But I also accept self-pay too. And for the individuals who do not want to go through their insurance.
Okay, interesting. In terms of the various things that you do and the various roles that you have, what's kind of working well for you? What have you spotted as one of your kind of winning strategies, or things that you do with your patients, or things that you do in running the business side of things or the education side? What's kind of working well for you?
Yeah, I would say that, using education as like outreach, and I would say that's the side of what I do. The education pieces and the education components are really what is, I guess, viewed as like outreach. So letting those pieces carry on and influence, neighbors and them. So that's kind of like where I get a lot of patients to come, specifically to come see me. Highly emphasis on education.
Okay, interesting. And what parts of the patient experience do you wish you had more time to optimize? Because obviously everybody's under time pressure. You've only got so many hours in a day. You only see so many people, and you only got a certain amount of time with a particular patient. What are the sort of thing?
I'm sorry. So, I believe your question was like, what could I spend more time doing?
Or what would you like to optimize in terms of the time that you have, in terms of the patient experience? So if you had more time, or you could better optimize the time that you had, what would the kind of thing be?
I think it would be the prior to the patient coming in, having the testing done, having the questionnaires filled out, reviewing that, and I think just, when you only have like, say, maybe 3 visits with a patient, an hour for your for the initial consultation, and then maybe 2 follow-ups, it's important, I think, to have like all of that initial, get the data and the testing and the questionnaires that they all have to fill out ahead of time. So really, work at making sure that process is more efficient and optimized. So that way, when they do see me, it allows us to like better focus on, their goals and their treatment.
I understand. And are there any, what was I going to say? How do you currently handle the administrative load? I'm guessing with the different roles that you have and some of the things you've just alluded to around testing and forms, how do you handle all that admin? It's something I'm sort of very interested in different clinic businesses, is how they kind of manage, obviously, the patients that they see, but all the kind of the admin and the stuff in the background as well.
Yeah, and it's I'm always looking for ways to keep it, to keep up on, clinical notes and everything. Recently, I've been using different, looking into different platforms, portals that, clients can go on and fill everything out. And in our EHR, or electronic health records platform, does a great job at communicating with other offices. So if they had testing done at, like, say, a hospital somewhere, those results would be, I'm able to like view those results. So like the different softwares that are able to talk to each other. That does save me a lot of time, so I don't have to like call an office and have records transferred over or anything. And my team, again, I can't say how much I appreciate the team of like nurses and admin workers and even my practice manager, how much work they do and how much support they offer me. So my time is well managed. So,
and speaking of team, because you've referenced them a few times, how do you balance team communication when you're working in different clinical environments? Obviously, you have the 2 places that you work, and then you do your outreach and your education. How do you kind of keep everybody on track with what's going on?
Calendars. Yeah. Well, notes. Like, everybody is really good with notes, taking very well detailed notes. And our system is very set up. We do send out like weekly emails, recap emails, and we set time aside at the beginning of the week to discuss, critical patients or important issues that are coming up. It goes back to my EHR, the EHR that we decided to use, which is eClinical, is wonderful at keeping very well detailed notes. So
it's all about the tech. And
yeah.
what's something you wish that your patients better understood about your role? Obviously, you're working with patients in lots of different settings. What's the one thing you wish they better understood about what you do?
How it really, how much care we really care, every person that comes in, we're really taking the time. So when, we offer the recommendations and we, go and develop a treatment plan, it's really well thought out and thought through. And it's really designed, personally for every person, so, it's really well planned out. So, yeah.
Got it. And on that note, are there any sort of moments when expectations between the patients and your team and you misalign, and what kind of things are those things and how do you handle them?
I guess to go back to like communication, how important it is to communicate with your team so everybody really understands, what the expectation is, and from everything from like booking to scheduling to the insurance side. I would say like those expectations is, this is what having a system in place. I think that's the important thing is, having a really thought out system, well thought out system.
Got it. So, and in terms of where you would like to be in 6-12 months time with the different practices you work in, what's your kind of plan for the future? More of the same, or do you have any particular plans for growth, development, expansion?
Yeah, we're currently actually expanding. I work with another private company. I'm working into like more social media. I can't, go into too much detail because we do have like a non-disclosure with the company. Mm-hmm. But we do have some exciting things coming out. Working with like some supplement brands, some fitness companies, and doing more into like that consulting, branching out into more like consulting for businesses and corporations. So,
I mean, does your expansion in the clinics you work in, are we talking also about being able to see more patients somehow, getting more people in, or is it more about sort of diversifying into the things that you've just mentioned?
I would say it'd be like to diverse, so and keeping, the one-on-one patients and clients. Those are like the most critical, the ones that are, I guess, the most critical in need. So I do expand, there's some expansion, again, going to the non-disclosure, but into working with other clinics too. But, and having clinics like partner together. So, but yeah, I would say I see about like 12 patients right now a week. Mm-hmm. But the 12 patients that I do see, again, they're the ones that are probably the most, I wouldn't say they have the conditions that, dictate that like we need to, see these, make them a priority. So.
Yeah, I mean, and the reason I ask is because it sounds like you're in a field where there must be massive demand for what you do. And I'm just wondering, I don't know whether you have a waiting list or whether you have a sort of, whether you're saturated. And I just wondered where the kind of demand for this is, and is it ever going to be met? Because I know there's probably few and far between in terms of people that do what you do. I'm just trying to get a sense of, how do we service all of these people with these huge needs that you've kind of alluded to?
Yeah, we do develop resources. That's something I'm, with the university work, we look at building our resources, into, other, into programs, group programs or public health programs. So that is one way that we can look at, servicing a greater need, providing mentorship to to other nutritionists that are up and coming in the field, so the schools that we work with also have other nutritionists that we work with that I do meet with on a periodic basis to discuss their needs. So what I found is as things build, you have to increase capacity to do more. So as we're building up that, building up the need, or we're identifying new needs that come in, there's the natural process to like, okay, well, let's look at the capacity and where can we, develop new resources or tap into to other systems or other, other methods. So.
Thank you. If there was, I was going to say, if there was one bottleneck in what you do, and you had a magic wand to fix it, what would you wave your magic wand at? What would you want to get fixed in terms of bottlenecks or things that limit what you do?
Oh my God. That insurance. Anyone's that ever had to like work with insurance, make it easier for everybody. I would say that one, because it's really, it could limit, could really limit people from getting, the help that they need, or the knowledge that they need, or the care that they need. So yeah, I would say wave a magic wand and, make it easier, an easier process.
I think everybody I've spoken to in the US has said exactly the same.
Yeah.
And then finally, if you were to sort of start again tomorrow from scratch, what would you do differently in terms of the various things that you've been involved with? What would you do if you had to start from scratch tomorrow?
I think I would, probably get like my doctorate, keep going, but I'm still young, I'm young. I could probably still do it. So continuing education. So, helps expand your reach and expand, I can go back to the capacity, like it's a big resource to have, and it's wonderful, when it's available. So.
When you say doctorate, as in what kind of doctorate?
Like naturopathic doctor.
Okay.
So, yeah. So, no, which is, huge need in this area too for that, and and also just being a pediatrician too, or someone who specializes in that kind of care. So, we do see that. I have partnered with some NPs, and we have one in our office too at Bay Pediatrics too. So,
cool. Nathan, thank you so much for your time this afternoon. Really interesting hearing about your work, what you do, what goes in your business, the outreach you do, and I'm very interested about the education and how you're managing to get the younger generation to have an appreciation for healthier food. I think it's a really, really useful and productive thing. So thank you very much for your time. Really appreciate it.
You're welcome, and enjoy your day. Thanks.